Hey everybody, welcome to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be discussing a medication that I covered in the past called Escitalopram. We're going to make a more simplified version of that video. And we're starting right now. So the first thing we'll discuss in this presentation is what this medication is used for. So Escitalopram, or Cipralex, treats depression, and it also treats anxiety. Now in terms of how to use this medication, first off, take your medicine as directed. You may need to take it for a month or more before you feel better. Your dose may need to change to find what works best for you. And this medicine should come with a medication guide. And if you didn't get one, just make sure you ask the pharmacist and they should be able to provide you with one. And it's important to read through that just to make sure you have a good understanding about all the ins and outs about your medication. What happens if you miss a dose? Well, if you miss a dose, you would take a dose as soon as you remember. If it is almost time for the next dose, you would wait until then and take a regular dose. Do not take extra medicine to make up for a missed dose. We'll now discuss some warnings associated with Escitalopram. The first one here is to tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, liver disease, bleeding problems, glaucoma, heart disease, or a seizure disorder. For some children, teenagers, and young adults, this medicine may increase mental or emotional problems. This may lead to thoughts of suicide and violence. Talk with your doctor right away if you have any thoughts or behaviors that concern you. This medication may cause the following problems. So serotonin syndrome. This is more likely when it's taken with certain medications that also affect serotonin. Low sodium levels or increased risk of bleeding problems. This medicine may make you more drowsy or dizzy. So do not drive or do anything that could be dangerous until you know how the medicine makes you feel. Do not stop this medicine suddenly. Your doctor will need to slowly decrease your dose before you stop it completely. So for this medication, if you were on 20 milligrams, you may need to go down to 10 and then stop, or even then go down to 5 and then stop. It may differ from patient to patient, and each doctor may have a different preference of how they stop the medication depending on how long you were on it and what dose you were taking. Your doctor will check your progress and the effects of the medicine at regular visits, so it's very important that you're sure that you keep all of your appointments to maintain that regular follow-up. Call your doctor right away if you have an allergic reaction, so itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness, trouble breathing. If you have anxiety or restlessness, fever, sweating, muscle spasms, nausea, vomiting, diarrhea, or seeing or hearing things that aren't there. This could all be a sign of serotonin syndrome, so it's important to go see a doctor at that point. Confusion, weakness, and muscle twitching, eye pain, vision changes, or seeing halos around lights. A fast, pounding, or uneven heartbeat. Feeling more excited or energetic than usual, racing thoughts, or trouble sleeping. This could be a sign of hypomania or even that you're getting pushed into mania due to the medication. If you're experiencing seizures, you would want to call your doctor right away, or unusual bleeding or bruising. Now, these following side effects, you would just talk to your doctor at your next appointment, or you could even talk to your pharmacist about it when you're in to pick up your prescription. So that would be dizziness, drowsiness, or sleepiness, dry mouth, headache, nausea, constipation or diarrhea, and sexual problems. All right, everybody, that's all we're going to talk about today with Escitalopram or Cipralex. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. But for today, take care.